So then you're going to do the Q, this vitamin C stuff, right?
Yeah.
Okay.
And then the other ones will kind of go back and forth.
Mm-hmm. All right, it's the Practical Medicine Podcast with Dr. Rob Balko and
Dr. Stephanie Lipnicki. It is the goal of this podcast is to bring awareness about the many different ways to maintain health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between. And today we're going to do a Q&A and miscellaneous things. So some of these questions are from lingering from previous episodes that either we wanted to research a little more to give the right answer, or we didn't have the answer right in front of us. And we also have a special announcement. Do you want to give the announcement?
which announcement is that?
There's
There's a $9.99 off sale.
Yes, $9.99 off. That we're switching from every other week to every week moving forward, and doing things in shorter chunks, so a little bit more digestible, because there are still some topics that may go a little bit longer, but we're going to kind of break them down then into 2 different episodes so that people can digest that a little bit better. We just thought that was a better format.
A little bit shorter, but more often.
Yes. So the first question that we had was from our loyal follower, Daryl, and she had asked if there was a difference between liposomal vitamin C and regular vitamin C. And I usually just have patients do emergency, which is like a powder that they can add to a drink. I tell them to take that with them when they're traveling. So I didn't really know a lot about it. And the research that I found is fairly new. So in one study by, and I'm not even going to be able to say the second name, it was like Gopi and Balakrishnan.
Very good.
In 2020, it showed that liposomal vitamin C was shown to be absorbed at 1.77 times greater than non-liposomal vitamin C, but still less so than if someone is getting intravenous vitamin C. And then in a study in 2016 by Davis et al. Compared encapsulated versus non-encapsulated, and they found similar results. And oddly, they referenced a prior study where only 2 participants were compared. And to me, that's so limiting. That to me, if you have 2 participants, it's a case study. It's not even like a study at that point, which is one of those things that we talk about a lot when we're researching things, and you look to see, if the conclusion says X, Y, Z, how many participants? If there's only 10 participants, then maybe you want to see 100 participants and look to different types of studies. Yeah. And I compared the supplier that I use for my patients, and 1,000 milligrams of liposomal C runs about $46, and non-liposomal C runs about $20 to $30. So if, someone who doesn't have strong digestion, given that the studies are showing that the liposomal is better absorbed, I would say go with the liposomal C, even though the cost is more, because you're going to be absorbing more and you're not going to have to take as much as if you did if you were taking the non-liposomal. And I always, with something like that, where it's not like, you're not talking about insulin, where it's a matter of like, hey, you don't want to play around with insulin. Yeah. You could play around with each type of vitamin C and then decide which you feel more comfortable with, which one doesn't upset digestion. Like, I'm one of those people that if I take too much C, it doesn't do well with my digestion. Sure. So, and I'm always curious to see where that research will go in the next few years. Like, will it be something else? But it does look like, from the studies that I saw, and for people who don't know, vitamin C is considered water soluble, and it has antioxidant properties. So being water soluble, it can make it harder to cross like barriers that are in the body that are considered hydrophobic or afraid of water, not water loving. So encapsulating the C with a lipophilic, so fat liking capsule can allow the C to be absorbed in greater amounts for those fat loving cells. So certainly a conversation for, people to have with their practitioner, which one they think is better for them. And then when we did the winter episode, which I believe was our last one, we had a question about how do you prepare for the winter water time of year if you are a fire sign. So I don't study like the zodiac that well. I mean, I'm fascinated by it. I love it. I love looking at the different aspects of 5 elements, but I didn't go to a 5 element school. So a colleague of ours, John Golden, who is a licensed acupuncturist in Sacramento, he studied 5 elements, and he said that he described fire as being all about connecting, and that in the resting time of water or winter, it's good to think about how one can look to within to connect with oneself, and that connecting with one's own authentic desires so that when it shifts to a more active time, say in the spring and summer, that fire that person has can be expressed more, and it comes out and it allows that connection with other people.
Right.
So I thought that was a
Nice.
interesting way of explaining it.
And to bring it back to the winter aspect in terms of Chinese medicine and 5 element, I would say look more at fire as embers in a fire, right? As you're cultivating that connection.
Right.
In addition,
Not the blazing fire, like a lower.
That high summer blazing fire of the sun in
Right.
the sky and things like that. But more of connecting
Right.
with family, right?
Yes.
At the hearth of the home, and storing that energy, which is
Right.
much more of a winter water
Right.
aspect, right?
Yeah. Preparing for what's to
right,
come. It's like that.
concentrating and preparing.
Right. Getting ready to end that one cycle and move on to the next
So
cycle.
that we can move into the spring cycle and
Right.
bring that energy forth.
And I think that that's kind of what then happens, like if you don't take that time to sort of go inward and sort of recharge a little bit, then the wood element gets out of balance, and that more of the emotional aspect of like frustration and anger and the, it sort of doesn't expand the way the wood element should when the spring starts.
Right.
And then that wood needs to be there to nourish the summer fire. So, it's still all connected and one generating into the next.
Which brings us to the next question: is if that's not done, and I think a question came up for you specifically, is how do we control Stephanie's wood energy to keep her from dropping F-bombs? And how is it possible that for an entire hour we can have Stephanie not...
I'm not quite sure how we've made
fire
it.
forth?
But I don't know that, because, okay, so my zodiac is I'm an ox, so we'll be going into, because we're going to end the lunar in February.
Yeah. This
So
is your year coming up.
Yes, it's my year coming up. I'm actually a water element. I'm a crab in the regular zodiac.
Okay. The
I don't know
the solar zodiac.
Yeah, the solar zodiac. So I feel like the F-bombs, I don't know if that just comes from being in Jersey.
Yeah, I think that's
I think that's just a Jersey thing. And I mean, I drop them all the time in the treatment rooms. I think the only times I control it at my office are when pediatric patients are there.
Yes.
Because I'm like, oh gosh, I don't want to do that in front of little kids.
Right.
In fact, but funny, like a side story with that, my sons told me that, like, because I assumed I was the one who probably taught them that word. They admitted that it was in the elementary school bathroom that somebody wrote it on the bathroom wall.
Oh, wow.
And that's where they got it from. So it wasn't me. I don't know how I control it. I feel like we've made it pretty far without one slipping out.
You're
I
doing
think
well.
I dropped an S word once, maybe.
Yeah.
I think I might
I
have.
think you did, yeah.
Yeah.
Sorry, I was trying to pull up the questions followers might be posting. Started our music there for a second.
Yeah, let's see if there's any
So,
in the meantime. Do we have any actual questions? Okay. A lot of highs. Hey, everybody.
Oh, great. Yeah, I can't see them on my phone for some reason.
Rob's going to just keep starting the music
Yeah.
that I picked for the podcast.
Until you drop an F-bomb.
Until I drop an F-bomb. Shut the... No.
We have one here. I don't know if you want to answer it. What's the difference between buffered and unbuffered vitamin C? Do you want to?
That one I don't know
Okay.
either. So now
We
I have
need a
another question for the
pharmacist
next one. Yeah, so we'll write that down so the next time we do a Q&A, I can answer that question a little bit better. You know what's funny is that, so my bachelor's is in dietetics, and everything in dietetics is not what I thought it was going to be. Everything was about counting calories,
Right.
not so much about nutrition, not so much about wellness, not so much about, their thing I think mostly was just take a good multivitamin. And I'm like,
What's good?
no.
Centrum?
Yeah, probably. Like Centrum that if you dropped it in acid would still be a pill a week later.
Right.
Just not even break down. And I will try and control the F-bombs, but I can't promise that one will never slip out.
See what we can do.
There was a question that went back to the cosmetic acupuncture, skincare, microneedling, and it was about which specific ingredients to avoid in skincare in the SPF. So you want to avoid parabens, retinol palmitate. You want to avoid oxybenzone and octinoxate. You want to look for something that's going to protect against a combination of UVA and UVB, as in boy.
Yep.
And I always say to look for one that at least has the seal of the American Cancer Society. This is a joking conversation that goes on in my house all the time. Andrew, aka Melodrama, swears that coconut oil is the cure for everything. He's like, it's a sunblock, and I'm like, no, it's if you want to be like a crispy critter, go ahead, you put all the coconut oil you want on you, but that is not SPF. Do you want to talk about how
Sure.
you? So one of the things that we do sometimes is we have to explain the good and bad in life to our patients, and you were telling me that you use a scale, so I made Dr. Rob bring his scale in to show me how he explains to patients how you can balance certain things in your life.
Right.
So-
What example should we use?
Let's compare. Okay, so we're going to, let's say it's somebody who goes out drinking, heavy drinking,
Okay.
but they exercise and they take supplements.
Right. Good. Perfect. Because that's what it really becomes all about is balance, right?
Right.
I tell so many of my patients, if you eat well and exercise 80% of the time,
Right.
sure, Friday, Saturday night, go out and have a good time. But
Right.
get up in the morning and get back to it, right? Have a healthy meal and get out there and exercise and move that stuff back out of your body.
Right.
So you can be the blue and I'll be the red.
Okay.
We'll say that the red is bad,
Okay.
right? So I had a couple drinks on Friday night.
Okay.
But what did I do to balance that?
You took your supplements.
Right? And drank some water, maybe, right?
Okay. Do you want to give water a whole nother one of these or no?
But then I had a little more and I had a real big greasy steak.
Okay, so we said this was supplements, but you exercise
Got
3
up
times a
early
week.
and went for a nice run the next day and exercised, right? Lift some weights and stuff like that. But then it was Saturday afternoon and my friends came over with some real bad food, right?
Oh my gosh. You went and saw your acupuncturist.
There you go. Look at that.
So I have now tipped the scales in my favor.
There you go. But then I really like meth.
Meth? Like methamphetamines.
Okay. Maybe
Get
it was
out of my office.
Maybe it was a little fentanyl. So but I use this a lot as just an analogy to help people understand. Is it's all a balance, right? Is you can overdo it both ways,
Right.
You know, you can not do anything to take care of yourself,
Right.
right? And you're going to wind up like this, right?
Yes.
And now you've got diabetes and high blood pressure, right?
Right.
But what can we do about that, right? You
Change
can
your diet.
You can change your diet, you know, right? And it's still like this is, you know, long-term abuse, right?
Okay.
And through exercise and diet and
Then start tipping the scales.
supplementation and acupuncture, we can bring it back the other
Right.
way. Yeah.
So we were talking about before this that I have like all kinds of toys, and now you know I'm gonna want to have the scales to show my.
Bring stuff
I
in.
have to have a new toy at my office. Now I'm gonna
right.
be on Amazon when I get home. I have to have the scale. I have to have the scale.
Or next week you'll bring in some of your stuff. You
Yeah.
have to bring in your hoodie.
Yeah, I did bring Dr. Hootie a couple times. Actually, I may have Dr. Hootie in my bag.
You'll have to explain to the audience who Dr. Hootie is now.
So Dr. Hootie came about because my maiden last name is Huth, but in German it's pronounced Hoot.
Hoot.
So I don't really know whether it was like my uncles and my cousins. Somehow the whole thing came about that everyone would say, "How you doing, Hootie?" And I guess it went back to like when my grandparents were even still alive. And my cousin Freddie's daughter, Tori, brought this little beanie baby Hootie over to my dad. And somehow when my father passed away, I think I ended up with it, and then it got lost, and I had to go on to eBay to find a replacement. And I decided that Dr. Hootie should be the office mascot. So like Alex, the girl who is my office manager, knitted a lavender scarf. There's a yellow dress for when it's Endometriosis
Wow.
Awareness Month. She made a mask for Dr. Hootie. And I just, like sometimes bring Dr. Hootie places and I'll take pictures and then share them on Instagram. So use it to tell some stories. So.
Yeah. Dr. Hootie definitely needs some TikTok videos. I
Yeah,
think.
right? I'm going to have to get
Or
on that.
reels or-
Yeah.
Yeah, some shorts.
So,
We have a top fan question here
okay.
from Chinese medical nutrition perspective on how to support the body post-COVID infection. Are there foods you should stay away from or eat more of? All right. Do you want to take that? You want me to take that?
We can both take that, I think.
Yeah, of course.
So
I have,
I say continue with the vitamin D.
of course.
I recently, a colleague shared that to help with the loss of taste and smell, to use vitamin A drops in the nose.
Okay.
I think that if there's any lingering, like phlegmy kind of feeling, herbs that move phlegm, staying away from things like bananas that generate phlegm,
Right.
staying away from sugar. We always
Sure.
come back to the sugar
Sure.
thing because
Well-
your body is trying to heal from all of that.
Yeah.
Doing breathing exercises.
Right. Strengthen the lungs.
Yeah.
So, COVID is a damp disease.
Right.
The Chinese call it a damp plague.
Yeah.
Which makes sense for us. For our followers, the reason is it's this accumulation of mucus and dampness in the
Right.
body. We call it dampness, but it's phlegm, mucus, excess fluid. It makes perfect sense how that can damage the lungs.
Right.
So
Lung is the receptacle of phlegm. Like
right.
the spleen generates it and the lung just accumulates it.
Right, and that's why we have digestive problems, because now the spleen is involved, which is really the
Right.
spleen and pancreas, which is responsible for digestion.
Right.
So that's why sugar is such a bad thing, because it creates a lot of excess mucus
Phlegm.
in the body. And I have a little chart here, a little list of foods that are really good for this, right? And I'm going to say them, and you're going to throw in some words about why,
Okay.
right? Like garlic is
It's antiviral, yeah.
fungal, right? It was actually used in World War I for all the amputations that were taking place
See, I
from
didn't
these
even know that.
crazy weapons that they had that were blowing arms off, right?
Okay.
Or damaging them where they had to amputate, right? And otherwise they would get gangrene. They used garlic, and
Okay.
they were able to survive. Yeah, little fun fact there. And
That's neat.
sad and horrible
Yes.
sounding. And onions, very similar, right?
Right.
let's see, green vegetables, loaded with nutrients, and also astringe
Antioxidants.
the body.
Yeah.
Right? Kumquats are great for reducing mucus in the body. Pineapple, oranges, citrus fruits really, limes, lemons, grapefruit,
Yeah.
asparagus, ginger. Right? That also brings heat into the body to help break down that,
Right.
that heavy
It's
mucus.
moving.
Right? And cauliflower. Should we talk about the things to stay away from?
Yeah. Sugar.
Sure. Well, everyone on my list, you're going to say there's sugar in it, is syrups, jams and
Right.
jellies, corn, cottage cheese, ice cream, milk.
So the milks and stuff, that's
Right.
dairy. It's phlegm.
It's
We
all
consider that
very
very
damp,
phlegmy.
very mucus producing in the body.
Right.
Butter, potato chips, even ghee, deep fried foods, soy, cakes, anything baked, really, baked bread,
Yeah.
cereals, ice cream, pies, pretzels, safflower and sunflower oils, cookies.
Lots and lots of sugar.
Right. Yeah.
It's funny because people don't think of like bread as being sugar. And it is. Anything that pretzels and bread, anything that you put in your mouth that just kind of like dissolves, it tends to be more
Food
sugary.
that's been processed for you.
Right.
It's been pre-digested, so it very
Right.
quickly turns into sugar. So that's not good.
Yeah.
So, what else you got?
So, one of the questions that a lot of our colleagues, and I agree, hear from people is, do you have to believe in acupuncture for it to work? And one of our colleagues, Pamela Howard, said she said, like people are like, oh, is it a believe in it thing for it to work?
Very good question.
Is it just a placebo? And she said she has two responses when people ask her about this. She said, think about veterinary acupuncture, especially like horses. The Olympic equestrian team uses it. There's a lot of horse farms out by where I am, and a lot of those people, when they come to see me, will say that their horses have had acupuncture first. So horses are not going to, a horse isn't going, oh, I believe that, when this person sticks a needle in
She
me.
seems like a nice person. I'm sure I
Right.
feel better now.
Yeah, exactly.
Yeah, anyone who owns a dog, a cat, or a horse who's had acupuncture, veterinary acupuncture on their animal will tell you that,
Right.
it worked
Right.
either fantastically or maybe it was a little too late. We all know
Right.
about the dogs, the retrievers with dysplasia.
Right.
I think bulldogs have a lot of pelvic
Yeah.
problems, orthopedic problems. And anybody who's had it done will tell you that
Yeah.
it's worked. And they've done studies on pigs, and they've shown a reduction of I forget what it is in the body, pain
Right.
hormones. So you can't really trick a pig into
Right.
thinking that he's feeling better when you're measuring hormonal levels in the body.
Right. And then the other thing she said is that, and I feel like almost every acupuncturist will say this, when people come to you, they've tried everything else, and that then this is what works. And, if it was a placebo, I mean, when you've tried other things, you're trying them because you believe that they're going to work. So why would it be a placebo effect that now this is the thing that actually works? And I feel like it's this. Yeah, I feel the same way. Or I think a lot of times we hear colleagues, and I've heard this too, where people will go, yeah, it must be like something completely different, unrelated. And you're like, no, it couldn't be the fact that you were coming for acupuncture for the last month. It has nothing to do with whatever's getting better. So there's a lot of, I feel like we don't get credit for the work that we do a lot of times.
Yeah, it's a little hard for people to get their head around it when it's so foreign, right?
Right.
They
Or how could just so few needles work? You know?
Right. Well, it's a matter of, to me, familiarization.
Right.
Is everyone I know takes Advil or Aleve or Tylenol, so I'll just take it.
Right.
And I'll never question what it does or what's in it. But
Right.
if you hand me this strange bottle, I've never seen this before. What could it
Right.
possibly do? Right. What's in
Right.
it is the first question they ask
Yeah.
you, and you say, "Well, it's Chinese herbs, isn't it?"
Right.
And that's a mental block for them.
Right.
So we have another question: supplements that are best to help regulate blood sugar.
A lot of people take Gemna sylvestra.
We should write that into the word.
Yeah, I'll put it in the comments
Okay.
because I.
Yeah, it's John. I know John. John is not an acupuncturist. So
Okay. Yeah.
he's got a you know,
Yeah,
may not have
sometimes.
heard of that before.
Yeah, sometimes I think it depends on the pattern. I mean, for some people, is it that they've been eating too many bad foods and they haven't been exercising? It really varies from person to person, but supplement-wise, that's one of the ones.
What if it's that hereditary blood sugar?
Like not type 1, type 2, and they're
Right.
thin. And I think that sometimes you can do everything right and
Yeah.
you're still going to have to be on a Western med. I feel like insulin is the one, or
Yeah.
like blood sugar issues are always the one that I go back to, that if you have tried diet and exercise and all these other things and it's a hereditary component, you may still need to be on
Yeah.
a Western medication to manage that. Sometimes things will change with acupuncture and you won't need as strong a dose. I've seen that happen with people. Or they'll need it periodically and then not need it periodically.
Right.
So I think it just depends. Do we have any other questions on there, or should I go to the next?
You can go to the next one.
Okay, so the common question that we all get is how often do I have to come in? And again, that really depends on what somebody has going on. I feel like if somebody has had, let's throw lower back pain, because I feel like that's something that we all as acupuncturists commonly treat.
Sure.
And you've had a car accident when you were 18 and you're in your 40s and you're still having lower back pain, I feel like at the onset, I want to see that person twice a week, because I feel like if they wait a whole week to come in again, they're probably in reality only going to feel relief for like the first day. And then when it comes back, they're going to go, but I only felt relief for 24 hours. And I try and explain that, like when I put the needles in, my needles are telling your body, this is what normal is supposed to feel like. And someone has a pain pattern and that their body goes, no, but I like that pattern and I want to stay with it.
Some
and I
studies
don't
have shown that what happens is the nerve pathway doesn't know any other signal but to send the
Right.
pain pathway. And
Right.
We're really reconditioning it, retraining
Exactly.
it.
Yeah. So I feel like that's one of those things. And eventually I find a lot of people, once that pain is gone, they just feel so good with the acupuncture that
Yeah.
some of them may just do maintenance once a month just because,
Sure.
you know, that relaxation. I particularly see that with moms, that they're like, this is my 30 minutes of peace and quiet. And I'm like, that's fine with me.
Yeah.
You know, like they feel like their stress level's lower and it's not.
Sure. Well, it's changing everything, right?
Right.
You know, again, it's the scale, right? It's having
Right.
that much pain in your body is keeping you from enjoying your life.
Right.
Right. And that's what I try and explain to them is
Yeah.
we're actually creating like a drain, a
Right.
valve where we just open it up and every day it
Yes.
hurts. You know, and I'm sure you know a lot of people have heard this idea among people with fibromyalgia of I have only so many spoons in a day.
Yes.
Right. So you have your 3 spoons, or maybe you have 2 spoons, and that's
Right.
it. And taking a shower is a spoon, or maybe
Right.
2 spoons, and that's it for the day.
Yes.
Right. So some people, I'll make them come in 3 days a week.
Right. Well, that's one of the things that I forget who brought this up recently, that if you were in China being treated, you might be getting treated 5 days a week.
More than
we're-
once a day.
Yes, more than once a day. And that we're trying to explain to people, hey, we want you to come 2-3 times a week. And they're like, oh my goodness. But that's how they get a pattern under control faster with the repetition. Because if somebody's telling me that their pain is a 10, yeah, probably twice a day is a lot better.
And there are people in the U.S. that I know who will do a 10-day course.
Right.
You know, you're coming in once a day for 10 days, and then we'll reevaluate.
Right.
Because we really can't make any assessment because we have to peel away all this stuff that's been there for,
Right.
like you're saying, 10, 20, 30, 40 years.
Right.
So now we have a better picture. Okay,
Right.
we've gotten no results in 10 days of treatment. Okay, we've got a problem here.
Right.
What else is going on?
Exactly.
That hasn't been discussed so far. You know, or look, your body is now able to do this.
Where you weren't before.
Now we have proof that it can function at that level,
Right.
and then we move forward from there. Maybe we
Right.
start breaking it down. Maybe we do another 10 days, and we see where we are.
Right. I feel like there's some patterns, like with gynecological stuff. I feel like it can take 3 to 6 months just to regulate that. So, I try and tell patients, you may need to be looking at a year, not that you're going to come 3 times a week for a year, but in the beginning, you need 2 to 3 times a week. If it's something severe like with me with endometriosis, where you're going to need ongoing care. There is no cure for endo. This, for me, has always been the best relief, doing the acupuncture and the herbs. And if I slip off that course, I'm miserable. So I feel like with something like that, it's a lifetime commitment for me to my acupuncture and herbs. Otherwise, I can't function.
Right.
So it really does vary,
And that's where I find the herbs really help so well, because they're taking them every day.
Right.
And they can go about their life and not have to be at your office
Right.
1 hour or so
Right.
every day, or 2 or 3 times a week, whatever it
Yeah.
happens to be. And it's going to be a lower cost. They're not going to pay as much
Right.
for an acupuncture visit as they're paying for the herbs, and it's going to help them. It's going to change their body chemistry,
Right.
which
Again,
is so
it's that
important when it
homework.
comes to gynecological issues.
Right. Absolutely. The question that I feel like is the bane of my
Big
existence is acupuncture covered by my insurance? So when I first finished acupuncture school, I took an insurance billing class, and I remember that the instructor had said, now this is going back more than 10 years ago now, only 1% of insurance companies nationwide cover insurance. We only have up to go from here. And I swear that's not the case in New Jersey. We have plummeted down. There's a huge disrespect for what we do. There's not enough understanding of how our medicine works. So they're looking at things like somebody may need 20 visits for something just to get it under control, and then maintenance after that. And an insurance company is like, 20 visits? Well, if you went to a pain management, they'd give you drugs and it's only 1 visit.
Right.
Whereas we might be getting somebody to avoid major surgery. They may not need a knee replacement right away. They may not need a hip replacement right away. And they're not looking at the savings or things like, as a side effect of someone's back pain, I can't even count the number of people who have said, do you think that I'm not getting sick as frequently because I'm coming for acupuncture? Yes, I do.
Right.
So it's the other ways that we're healing the whole person. So I think that varies from practitioner to practitioner. It varies from state to state whether the practitioner is going to even want to get in the game of taking insurance. Yeah. I'm trying to get away from it because I don't like somebody else dictating the quality of care that I want to give to my patients. I have to ask myself, do I want to be the Walmart of acupuncturists, or do I want to be the Tiffany's of acupuncturists and have the time that I feel like I need to dedicate to complicated cases? I feel like if somebody is just coming in for stress, of course I can get them in and out in a short period of time. But like if I had somebody who had my own gynecological history who might come in sobbing, I don't want to have to tell them, you need to shut up and get on the table so I can put my needles in. Like, that's not how I want to practice. Right. So, So yeah, we all get asked that question, and it varies from policy to policy.
I try to explain to people that they're really making an investment in their health.
Right.
And this is the only body you get.
Right.
So it's worth starting to put into your budget how much do you want to spend a month taking care of yourself, because if you look at any other insurance, right, your homeowner's insurance doesn't pay you to put in weather stripping. It doesn't pay your auto insurance doesn't buy you windshield wipers every year, even though it's a great idea to have fresh windshield wipers every year.
Right.
It doesn't do those things.
Or to change the oil in your car.
So why should your health insurance pay for wellness visits or preventative maintenance? This is an insurance against a problem.
Right.
There should be a different bucket for that, where you're investing and taking care of yourself. And if you do it up front, it's going to be a lot cheaper than it is if you have to pay later.
Yeah, it goes back to that. I hate to do the cliche of memes that are out there, but if you don't take time for your wellness, you will be forced. And it is a lot harder when somebody comes in and it is a major problem to then get it under control versus somebody who comes in regularly. Like, I can't tell you the number of times I've had phone calls where I have a booked schedule and somebody's like, well, I have an emergency today. And I'm like, I don't have 15 minutes to evaluate what you have going on. But if you came to me last month just to check out what I did, yeah, I could get you in, but I can't rush, and I don't rush through my intakes. So I feel like I have to have the time that I need.
I like to go with the adage of it's you don't wait until you're thirsty to dig a well.
Right.
So do it now.
Right.
I don't know how many times my patients have said, you were the last thing I came to, and I kicked myself wishing it was the first because none of those other things worked.
Right.
I didn't get the satisfaction, or it didn't make any sense. It wasn't, it was no,
Right.
it wasn't working. They didn't understand the problem, so they couldn't really solve the problem.
Right.
And we solved the problem right from the beginning.
Right. Yeah, I feel like a lot of acupuncturists say that exact same thing. I feel like we've all seen that in our practice. Before I go on to the other questions.
How long is a session?
Oh, yes. How long is a session? So
It's an
my
easy one.
my initial one is I set aside 2 hours, but I usually figure on 90 minutes. That's the intake and needling time. And then my follow-ups are anywhere from 45 minutes to an hour.
Yeah.
What about you?
About the same. Yeah.
Some practitioners, it's less.
Yep.
I mean,
Sure.
Again, I feel like I try and give the care that I want, and I want 30 minutes on the table.
I think you need 30 minutes on the table. I used to fill in for a chiropractor a long, long time ago, and it was a 15-minute acupuncture session, and I thought, wow.
I think it
that's
takes me
strange.
15 minutes,
Yeah.
10 to 15 to get, to chat and get the needles in. I feel like that to me is not. And I mean, I'm sure there is still some benefit that you
Yeah.
get from
So-
having them in for 15 minutes,
Yeah.
but is it the same as when you have them in for 30?
Right. So I think the overriding message there is every acupuncturist is different.
Right.
I'm looking at the comments over here, and Kathy Casey's on, and Stacy is talking, and Annalisa, and so many other of our colleagues, and I know we're not the same.
Right.
And I wouldn't want us to be the same.
Right.
Because we're providing individualized care.
Right.
For every person that comes to see us,
Right.
because everybody has just a little difference. When it comes to back pain, 80% of the time it's the same thing, but they each come with a different
Right.
set of needs and wants and expectations,
Right.
and we can manage that. And that, I believe, is what's lost in medicine today in the United States.
Right.
Is everybody fits into the same path. You're in that same little lane. Get treated the same way.
Right.
And if it doesn't work out, oh well.
Right.
We don't know what to do with you. And it's really unfortunate.
But
And-
even
and
like
for
take
just-
back pain. Like, okay, so let's say, and I will say when someone is face down for a treatment, I don't do 30 minutes. Mostly because I don't like being face down for more than 25
Did
minutes.
you know when you're face down, your body actually goes into a sympathetic response?
That makes sense.
Yeah. And
I
without
just feel
people
like I
even
can't
realizing
breathe.
it. And I can hear it already.
Yeah.
Just talking about it is most people who are face down, they wind up, like, oh, they need to blow their nose, or they're
Right.
starting to feel a little stuffy. That's a sympathetic reaction, right? So we don't want them that way. We don't want them uncomfortable.
Right.
We want them to walk out feeling good.
Right. So I don't necessarily do the same thing on everyone. Like patient A might get cupping for their low back pain. Patient B might get needles and gua sha. I still keep my hot stones from when I did last stone massage. Sometimes I'll do a little bit of heated stone massage if I feel like I want to relax the muscles. So it's going to be different even for that. Sometimes I've had patients who come in and do a back and a front treatment in the same visit. So then they're in the office for at least an hour and a half. Timing is definitely different.
It's individualized care.
Yeah.
And I think that's part of the message that is really important for people to understand is it's not cookie cutter,
Right.
right? You're getting individualized care.
Right.
And you're taking care of yourself. You're really investing in your
Right.
in your body, in your future. And the great thing is, like you're saying, is we're treating your back pain, but at the same time, we're boosting your immune system.
Right.
We're lowering your hormonal levels of stress.
All of that.
People are sleeping better. They're not getting sick as much. I we haven't really talked about it, but over the holiday break, I got COVID.
Right.
And I think because I've been taking care of myself against this since March, really,
Right.
it wasn't horrible.
Right.
I didn't have to go to the hospital. You know, there's some days where I tip the scale here.
Right.
You know, I have a good time with my life. And
Right.
I take care
But
of myself,
given
but I
that-
also
Right.
indulge. And because of the herbs I've been taking and the vitamins and supplements,
Right.
I feel
Staying
fine.
on top of all that.
Yeah.
Yeah. I mean, given that the last time that we had a podcast, you were in the studio and I couldn't because Andrew had COVID and I wasn't sure whether I was exposed or not and I didn't want to take the chance and come in. You wouldn't even like to look at you even think that you had been sick in the time, you know, that we had that break.
I wasn't sick until after that.
No, I know it was after that,
right,
but
right.
that's what I'm saying. Like that makes it an even shorter period of time that when you know, and I do feel like all of our colleagues have shared really fantastic protocols about what herbs to take preventatively, what herbs to take if you come down with it, what supplements you should be taking preventatively, what supplements to take if you come down with it. And I feel like that, you know, even I sent Andrew to Tennessee with herbs to take, and he had been taking some of them during that time because he'd had a sinus infection prior. So I definitely feel like, you know, those are things to take into consideration, that those formulas are there to help keep you healthy.
That's it. It's an investment.
Yeah.
Right?
So another question that we get a lot is, why aren't you putting needles in the areas that hurt?
Because they hurt.
Sometimes, I mean, sometimes it is directly in that area and
right,
sometimes
right,
it's not.
right.
Again, it's, you know, somebody may have shoulder pain, but you may do points that are distal, and then we have those referral things
Right,
that, like, the shoulder is the equivalent of the hip. The knee and the elbow are considered the same. So maybe you'll needle the knee to affect the elbow because those are reflex points, so to speak. So, and it, you know, some practitioners, we all have the similar foundational training, but then we branch out into different, you know, CEUs, continuing education classes, and some things resonate more in terms of treatment plans and what you do, and, you know, looking at, you know, different points that treat it different ways. So sometimes, yes, there are points directly in it, but sometimes because it is so painful, you can't even get a needle into that area where the person could lay down with it.
Right, right. There's a very famous acupuncturist who's passed away now. His name is Dr. Tan, and he would say, they would say, well, you know, no pain, no gain, right? He would say, no pain, right?
Right.
It's like, I'm going to put them where they don't hurt to make
Right.
that pain go away. Now you're not in any pain.
Right.
You know?
Exactly.
And that was part of what you're saying is treat the knee to treat the elbow, treat the
Right.
shoulder to treat the hip, or something like that. You know, and it's actually also channel-wise, they're connected.
Right.
So we're treating points on the channel, but further away.
Or sometimes it's
Yeah.
its sister channel. Like,
Again,
you know,
yep, there's all
the
there's
paired or, yeah,
there's
there's so many different
many,
ways
many
you can approach
connections, right?
Yeah.
And the original documents written 3,000 years ago on acupuncture say the furthest points away have the strongest action.
it. Right. Right.
So there it is. You know, this has been written and practiced for thousands of years.
Right. And then the other question, kind of referring back to that, why do some points hurt and others do not? And I've heard so many different things on this. It could be the needle itself, because I could put a whole bunch in and then someone will go, well, why does that one hurt? I don't know if it's because there's an excess in that point. Sometimes it does feel like you know, it's a little harder to get the needle in. There's a lot of different reasons I feel like it can hurt. And, you know, sometimes it's that point is more sensitive. It just varies.
I usually find that there's an issue on the channel, right?
Yeah.
It's channel related, or it's point related and channel related at the same
Right.
time, because the point is on the channel.
Right.
And typically the person's eyes will just pop.
Yeah.
Right? They'll say,
And they
know,
feel like you
they'll
zinged
say,
them.
I have this headache on the side of my head, and I'll go down to their foot and I'll put some pressure on certain spots.
Right.
And they'll say, wow, why does that hurt? I said, because I'm going to go treating your
Right.
headache, or other obvious ones that we don't need to describe right now. But same thing, right?
Right.
Women in their cycles, you know exactly where you're going to palpate, and
Right.
you're going to find super tenderness And
they're always going to be a little bit more sensitive at that time. I
and then
had
you can educate them on that and send them home maybe with some stick moxa or something like
Right.
that, or massage it themselves, or
magnets.
whatever, magnets.
I had this is going back a few years ago. The brand of needles that I used kept having duds, and the way I found out was
what's a dud needle?
they were like sharper. They weren't as fine. It was the particular manufacturer had, I guess, a bad batch, and it was every single point that I was putting in every single patient. I was like, wait a minute. I'm like, this cannot be me, because I tend to be a less aggressive needler. My feeling is as if I can make a change without it hurting, why do I have to make it hurt? Like, that's just always, and it was like every single point I was putting in, and I switched boxes, and it was the actual needles. It wasn't me. So,
While we're on that topic, I just want to point out to patients that, or prospective patients, is every needle is single use. They come,
yes.
they come sterilized. We use them once, they go in a sharps container, never use them again.
right.
There's no need for us to reuse them. They're
Right.
mass produced, the way they're made now, and they're
Yeah.
totally
Disposable. They
Disposable,
go into a
but
Sharps
sterile.
container. Yeah, sterile, single use. They
Yeah.
go into a Sharps container. That was one of the other questions that Pamela Howard said, that she gets
Okay,
a lot
great.
of patients
Sure.
asking about needle safety, especially that we don't reuse them ever. She said she's not sure if that comes from the fact that people realize that we're not, as she put it, in quotes, in regular healthcare. And it's like, no, we have standards. We have a licensing board that we have to
Right.
answer to. We're taught the right thing. And I always tell people that, like the concept of autoclaving, and I feel like that was actually questioned on the state exam.
Sure. Yeah.
And I thought, I am too damn lazy to ever sit there. Because I think you have to like wash first and then autoclave and then check
Right.
something. And I'm like,
Right.
and our needles are so fine. I'm like, would they even last that process anyway?
Well, that's another problem with autoclaving with needles is, first of all, they get dull from use,
Right.
which is a story unto itself, and then
Right.
they get brittle, and
Right.
that's where you can have a handle break off.
Right.
So this
I'm
is
like-
another benefit of single-use needles is,
Right.
have you ever had a needle break
Nope.
in how many years?
No. I finished school
No.
and
Tens of thousands of needles.
yeah.
Tens and tens of thousands of needles, and
Right.
never have a problem like that.
She also said she gets people who ask if they can keep their needles or take them home. We don't let people take them home. At least I don't.
Right.
I don't want to be responsible for. They go in the Sharps container. That's the end of it.
That's right. Yeah. There's not much left to them at that point.
Right. Any other?
I did have someone ask for gold needles. She wanted to be treated by gold needles only.
So I had a patient. This was a patient that I ended up firing because it was just not a good fit. Who basically had to have the gold needles because she claimed that the other needles gave her an allergic reaction.
Right.
I was like, okay. She was very, very high maintenance, and it was just too much for me.
I thought I saw another question, but now I don't see it. Past John Cipollini's. I think
Melodrama asked.
Annalisa maybe was asking about high blood pressure, maybe, or blood sugar.
Oh, asked about the other than red yeast rice. Red yeast rice is my go-to that I tell people if they don't want to. But I don't know other than that in terms of lowering blood pressure. I mean, definitely checking to make sure that the person is well hydrated. But yeah, I usually do the red yeast rice.
Yeah, that's what it was. Okay, thank you.
Yeah. And Melodrama, and I'm sure this question is to bust my chops. How do you keep your skin moist in the winter? I have baby butt soft skin by using tons and tons of
That's
moisturizer.
right,
I
that's
steal
right.
I steal the skin off of babies' bottoms. That's how my skin is so soft.
Let's not go there.
Staying hydrated, especially in the winter, is drying.
Yes.
It's a, you know,
Well,
we
when
have,
the temperature drops, the relative humidity of the air drops, and
Right.
we get dry skin.
yeah.
Right? And then we
And-
take hot showers, which further makes our
Makes
skin
it
dry.
drier. Yeah.
You know.
So limiting the time in the shower, not overheating, those kind of things.
People forget about that. The fact
Yeah.
that even on the East Coast, where it tends to be very damp, it's very dry. I
Yeah.
can't imagine what it's like out in Colorado and Wyoming, where
Right.
Stacey Donaldson is, where it's
Yeah.
You know,
super, super dry.
5% humidity in the air and
Yeah.
0 degrees or below.
Yep.
My skin is already itching just thinking about it.
People can have an, Daryl said that so people can have an allergy to nickel. Sometimes Serins can be helpful. I use Serins a lot on kids only because, so Serin needles are a brand that has different colored tips, and a lot of times I'll tell the kids that they can pick what
pick the color?
Pick what color you want, and it, for whatever reason, I mean,
You're
they can pick
engaging them.
Yeah,
right? You know,
they like to do
they
that.
love that. You know?
Oh, went back to the how long is a session with kids? I don't.
Yeah.
I generally don't leave the needles in unless they're like one of my pros where they love it. and-
okay.
But in
Yeah.
the beginning, sometimes you'll just insert and remove
Okay.
when they're really little.
Yeah, I would do like 10 minutes.
Yeah.
At the most.
Even
probably.
5 for some kids.
Yeah.
Their chi
You can
moves
tell.
differently.
And that's another fascinating thing. I don't know if this works for you, but as I was a patient, I was laying on the table, and it was my acupuncturist house because he worked in Pennsylvania, so he'd treat me here at home. And he would just be quiet, and I'd be relaxing on the table. And all of a sudden, he'd get up and take the needles out. And I said, "How do you know when you're done?" He goes, "Oh, you know." And I'm like freaking out. I'm like, "How does this work? How does this work?" And I'm overthinking it. And he would get up the next time and he would pick the needles out. And then I relaxed. I forgot all about it and chilled out. And all of a sudden the air in the room changed. And he got up and he pulled the needles out. He goes,
Yeah.
"See?" And I was like, "Yeah, that's really cool."
That's
and
one
now
of the things that one of my friends
I
says.
can be in the other room because I leave my patients alone. I close the door. I leave them, give them
Yeah,
quiet time.
I do too.
And I just know. I get up and I say, they'll tell me, "I was just thinking I was done."
Yeah,
And there's a certain amount of energy that needs to move.
right.
You know, and it's around the same time for most people,
I've had
unless
that
they're
happen
really
when I forget to-
sick or really old or frail or something
Yeah.
like that. You know?
I've had that happen when I forget to set a timer. And I'll just be like,
Right.
it's time.
time.
And I'm like, oh, I forgot to set a timer, but it just, you know that it's time.
Yeah.
So I think we went through most of the questions. I just wanted to thank everybody who was watching and listening
Yes, thank you.
today.
Happy New Year to everyone.
Happy New Year. And just to remind you, now we're going to go to an every week format. So 7 o'clock Monday still, but every week. Next Monday.
Caesar's back in town.
Next Monday is, and I'm not going to say the F word, it's going to be WTF is a doula. One of
I'm
my
going to make that the mission of the year. How soon into the year?
Can Stephanie
And your
drop-
goal is to try and last as long into the year.
Yep. That's what's going to happen.
Now that we've done 8 podcasts, I think it's
I
time
can let
to
it slide.
push a button a little bit.
Push to the limit.
Poke the bear a little bit. Let's see what happens here.
So Carrie Burke, who was one of my massage school students, is now a doula.
Her name's not Debbie Doula.
No, it's not Debbie Doula. I'm trying to think, do we know any doulas that are Debbie? I feel like I must.
I don't know.
But she's going to talk to us about why our patients and people in general would want to have a doula present at their birth, and explain all about what that is. We do not have topics yet for the 25th. February 1st, and then on February 8th, though, your colleague Clayton Shue has agreed to come on and talk to us, so I'm super excited about
Yeah,
that.
that's going to be fantastic.
So, and now we already have one more question for the next time we do a Q&A.
Right.
So,
That's right.
thank you, Ming, for the use of your studio. Thanks.
We like you said, we have some. We haven't decided what we're going to talk about. Feel free.
Oh, yeah, if you have a
anybody, if you
topic.
want to give us a topic,
Chime in.
we might ignore it,
Yeah.
but we may take it.
We have a list of some ideas, but we're always
Oh, we
open
have
to,
a very long list of ideas. We just haven't put them in. But if you have some anything of interest you want to bring in,
Yeah.
we would love to have that.
So we could just either pick out of a hat or or you guys can decide. But we want to
right.
see what, if
Right.
it's patients, colleagues, and they have patients who have questions, and
Exactly.
there's so much that we can cover.
And like we've said, the podcast is about everything from acupuncture to Zen living, right? So
Right.
we're doing a lot of acupuncture, Chinese medicine,
Right.
And next week is going to be a nice little offshoot
Segue,
of that.
yes.
But Clayton's going to bring us back into the real, using acupuncture for stroke,
Right.
and explaining his experiences in China and so on and so forth. But
Yeah.
it'd be great to get some more
Right. Adjunct modalities.
right,
Yep.
that we can discuss, even for part of an hour.
Right. Yeah. Sounds good. Thanks, everybody. Thanks, Ming.
The contents presented during the Practical Medicine podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Balko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.